Hyperthyroidism. Definition. Hyperthyroidism is a pathological disorder in which excess thyroid hormone is synthesized and secreted by the thyroid gland. It is characterized by normal or high thyroid radioactive iodine uptake, thyrotoxicosis with hyperthyroidism or true hyperthyroidism. Thyrotoxicosis is a toxic condition that is caused by an excess of thyroid hormones from any cause. Thyrotoxicosis can be caused by an excessive intake of thyroid hormone or by overproduction of thyroid hormones by the thyroid gland. Hyperthyroidism is characterized by increased thyroid hormone synthesis and secretion from the thyroid gland, whereas thyrotoxicosis refers to the clinical syndrome of excess circulating thyroid hormones, irrespective of the source. Risk factors. People are at higher risk for hyperthyroidism if they are a woman, are older than age 60, have been pregnant or had a baby within the past 6 months, have had thyroid surgery or a thyroid problem, such as daughter, have a family history of thyroid disease, have pernicious anemia, in which the body cannot make enough healthy red blood cells because it does not have enough vitamin B12, have type 1 diabetes or primary adrenal insufficiency, a hormonal disorder, get too much iodine, from eating large amounts of foods containing iodine or using iodine-containing medicines or supplements. Causes. Some common causes of hyperthyroidism include Graves' disease, functioning adenoma and toxic multinodular goiter, TMNG, excessive intake of thyroid hormones, abnormal secretion of TSH, thyroiditis, inflammation of the thyroid gland, excessive iodine intake. Graves' disease. Graves' disease, which is caused by a generalized overactivity of the thyroid gland, and is the most common cause of hyperthyroidism. In this condition, the thyroid gland usually has lost the ability to respond to the normal control by the pituitary gland via TSH, renegade. Graves' disease is thought to be an autoimmune disease, and antibodies that are characteristic of the illness may be found in the blood. These antibodies include thyroid-stimulating immunoglobulin, TSI antibodies, thyroid peroxidase antibodies, TPO, and TSH receptor antibodies. Graves' disease is hereditary and is up to 5 times more common among women than men. Thyroiditis, thyroid gland inflammation. Inflammation of the thyroid gland may occur after a viral illness, subacute thyroiditis. This condition is associated with signs and symptoms of fever and sore throat, often with painful swallowing. The thyroid gland is also tender to touch. There may be generalized neck aches and pains. Inflammation of the gland with an accumulation of white blood cells known as lymphocytes, lymphocytic thyroiditis, may also occur. In both of these conditions, the inflammation leaves the thyroid gland leaky, so that the amount of thyroid hormone entering the blood is increased. Functioning adenoma and toxic multinodular goiter. As people age, lumps or nodules may form in the thyroid gland. Usually, these lumps do not produce thyroid hormones and require no treatment. Occasionally, a nodule may become autonomous, which means that it does not respond to pituitary regulation and produces thyroid hormones independently. This becomes more likely if the nodule is larger than 3 centimeters. When there is a single nodule that is independently producing thyroid hormones, it is called a functioning nodule. If there is more than one functioning nodule, the term toxic multinodular goiter is used. Excessive intake of thyroid hormones. Taking too much thyroid hormone medication is actually quite common. Excessive doses of thyroid hormones frequently go undetected due to the lack of follow-up of patients taking their thyroid medicine. Other persons may be abusing the drug in an attempt to achieve other goals such as weight loss. Abnormal secretion of TSH. A tumor in the pituitary gland may produce an abnormally high secretion of TSH, the thyroid-stimulating hormone produced by the pituitary gland. This leads to excessive signaling to the thyroid gland to produce thyroid hormones. This condition is very rare and can be associated with other abnormalities of the pituitary gland. To identify this disorder, an endocrinologist performs elaborate tests to assess the release of TSH. Excessive iodine intake. The thyroid gland uses iodine to make thyroid hormones. An excess of iodine may cause hyperthyroidism. Iodine-induced hyperthyroidism is usually seen in patients who already have an underlying abnormal thyroid gland. Certain medications, such as amiodarone, codeine, which is used in the treatment of heart problems, contain a large amount of iodine and may be associated with thyroid function abnormalities.
Pathophysiology.
Symptoms and signs. The symptoms usually are related to an increase in the metabolic rate of the body. Common symptoms include excessive sweating, heat intolerance, increased bowel movements, tremor, usually fine shaking, nervousness, agitation, anxiety, rapid heart rate, palpitations, irregular heart rate, weight loss, fatigue, weakness, decreased concentration, irregular and scant periods, menstruation, fine or brittle hair, rapid heartbeat, thinning and or smooth velvety skin, sleep disturbances. In older people, irregular heart rhythms and heart failure can occur. In its most severe form, untreated hyperthyroidism may result in thyroid storm, a condition involving high blood pressure, fever, and heart failure. Mental changes, such as confusion and delirium, also may result. Diagnostic evaluation. Hyperthyroidism is diagnosed using medical history and physical exam. During the exam, the doctor may try to detect a slight tremor in client's fingers when they are extended, overactive reflexes, eye changes and warm, moist skin. The doctor will also examine thyroid gland as client swallow to see if it's enlarged, bumpy or tender, and check pulse to see if it's rapid or irregular. Blood tests. Blood tests that measure thyroxine and thyroid stimulating hormone, TSH, can confirm the diagnosis. High levels of thyroxine and low or non-existent amounts of TSH indicate an overactive thyroid. The amount of TSH is important because it's the hormone that signals thyroid gland to produce more thyroxine. Normal TSH levels, 0.4 and 4.0 millunits per liter, μl. Normal T3 level, 100 to 200 nanograms per deciliter, ngdl. Normal T4 level, 5.0 to 12.0 micrograms per deciliter, μgdl. If blood tests indicate hyperthyroidism, the doctor may recommend one of the following tests to help determine why thyroid is overactive. Radioiodine uptake test. For this test, client take a small, oral dose of radioactive iodine, radioiodine, to see how much will collect in thyroid gland. Client will be checked after 4, 6 or 24 hours, and sometimes after all 3 time periods, to see how much iodine thyroid has absorbed. A high uptake of radioiodine indicates thyroid gland is producing too much thyroxine. The most likely cause is either Graves' disease or hyperfunctioning thyroid nodules. If client has hyperthyroidism and radioiodine uptake is low, this indicates that the thyroxine stored in the gland is leaking into the bloodstream, which may mean client has thyroiditis. Thyroid scan. During this test, client will have a radioactive isotope injected into the vein on the inside of elbow or sometimes into a vein in hand. Client then lies on a table with head stretched backward while a special camera produces an image of thyroid gland on a computer screen. This test shows how iodine collects in thyroid. Thyroid ultrasound. This test uses high-frequency sound waves to produce images of the thyroid. Ultrasound may be better at detecting thyroid nodules than other tests, and there's no exposure to any radiation. CT/MRI scan. Management. Several treatments for hyperthyroidism exist. The best approach for patient depends on his age, physical condition, and the underlying cause of the hyperthyroidism, personal preference and the severity of disorder. Possible treatments include radioactive iodine. Taken by mouth, radioactive iodine is absorbed by thyroid gland, where it causes the gland to shrink. Symptoms usually subside within several months. Excess radioactive iodine disappears from the body in weeks to months. This treatment may cause thyroid activity to slow enough to be considered underactive, hypothyroidism, and client may eventually need to take medication every day to replace thyroxine. Antithyroid medications. These medications gradually reduce symptoms of hyperthyroidism by preventing thyroid gland from producing excess amounts of hormones. They include methimazole, thioprazole, and propylthiouracil. Symptoms usually begin to improve within several weeks to months, but treatment with antithyroid medications typically continues at least a year and often longer. Beta blockers. Although these drugs are usually used to treat high blood pressure and don't affect thyroid levels, they can ease symptoms of hyperthyroidism, such as a tremor, rapid heart rate and palpitations. For that reason, doctor may prescribe them to help client feel better until thyroid levels are closer to normal. These medications generally aren't recommended for people who have asthma, and side effects may include fatigue and sexual dysfunction. Surgery, thyroidectomy. If client is pregnant or she otherwise can't tolerate antithyroid drugs and don't want to or can't have radioactive iodine therapy, he may be a candidate for thyroid surgery, although this is an option in only a few cases. In a thyroidectomy, doctor removes most of thyroid gland. Risks of this surgery include damage to vocal cords and parathyroid glands, 4 tiny glands situated on the back of your thyroid gland that help control the level of calcium in blood. Hormone replacement therapy. In addition, client will need lifelong treatment with levothyroxine, Levoquil, Synthroid, others, to supply body with normal amounts of thyroid hormone. If parathyroid glands also are removed, client will need medication to keep blood calcium levels normal. Complications. Hyperthyroidism can lead to a number of complications. Heart problems. Some of the most serious complications of hyperthyroidism involve the heart. These include a rapid heart rate, a heart rhythm disorder called atrial fibrillation that increases risk of stroke, and congestive heart failure, a condition in which heart can't circulate enough blood to meet body's needs. Brittle bones. Untreated hyperthyroidism can also lead to weak, brittle bones, osteoporosis. The strength of bones depends, in part, on the amount of calcium and other minerals they contain. Too much thyroid hormone interferes with body's ability to incorporate calcium into bones. Eye problems. People with Graves' ophthalmopathy develop eye problems, including bulging, red or swollen eyes, sensitivity to light, and blurring or double vision. Untreated, severe eye problems can lead to vision loss. Red, swollen skin. In rare cases, people with Graves' disease develop Graves' dermopathy. This affects the skin, causing redness and swelling, often on the shins and feet. Thyrotoxicosis. Hyperthyroidism also places client at risk of thyrotoxicosis, a sudden intensification of symptoms, leading to a fever, a rapid pulse and even delirium. If this occurs, seek immediate medical care.
So guys, thanks for watching my video. You can like and comment on my video, but don't forget to subscribe my YouTube channel to watch quality content like this. Thank you guys.